Hello there again, and welcome back. Or if this is the first time that you're seeing me, welcome for the first time. My name is Dr. Peter Dinh, and I'm the owner of Atlanta Dental Team. And my goal in the world is to try to provide as much good information to you so that you can make the best decisions for yourself. Today, we are going to talk about our part 2 series in how to not get a cavity or how to prevent cavities. Cavities are the things in your mouth that eat away at your teeth, dissolve your teeth, cause them to break. And so we don't like those bad bugs in our mouth. So previously, in our previous discussion, we talked about bacterial biofilms. And just for those newcomers out there, a biofilm is a ecological system in which millions of bacteria congregate and communicate. The fact that they can communicate and congregate allows the entire biofilm or the ecosystem to be stronger, all right? Last time we talked about how a biofilm is created in your sink. You know, it's the little gunk on your sink. You'll notice that if you just spray the sink, a lot of the bacteria you haven't gotten rid of all the bacteria. You can spray it and then you can basically take your finger and just wipe it. You can feel that there's still gunk there. The same thing applies for our teeth. And so how do you prevent cavities, or how do you reduce the amount of cavities in your mouth? It all goes down to how do you destroy a bacterial biofilm. So you'll notice that if you spray the gunk on your sink, a lot of the bacteria isn't gotten rid of. The reason for that is because this is an ecological system. So there's a very specific species of bacteria that live on the outer surface of the biofilm. So think of the biofilm as having lots of layers. There are certain bacterial species that live on the inner layer, and there's certain bacterial species that live on the outer layer. Same thing goes with all biofilms, okay? So in order to destroy a bacterial biofilm, you wanna try to penetrate the outer tough layer, and you wanna try to get to the inner layer. The outer layer becomes very adaptable over time. That's why you start hearing things like, hey, if you take antibiotics, bacteria start to adapt to those types of antibiotics. So in your mouth, in order to remove the biofilm, you need a few things, but a couple concepts, 2 concepts. The 2 concepts is the mechanical destruction or the mechanical removal of the outer layer of the biofilm. You can imagine if you penetrate the outer tough layer, now you have access to the inner layer. There's 2 types of bacteria. Well, there's lots of different types of bacteria, but for our discussions today, there are anaerobic bacteria and aerobic bacteria. Aerobic, air, means that it wants oxygen. It likes oxygen. Anaerobic bacteria, they don't like oxygen. I know there's, for you science nerds like myself out there, this is not a technical definition. This is a very surface level definition, so please give me some runway here. So in a biofilm, there's aerobic and anaerobic bacteria. If you introduce oxygen into an anaerobic environment, that is not good for the anaerobic bacteria. So just the fact that you can mechanically penetrate the biofilm, you're doing a lot there. So we talked about 2 forms, mechanical, and the other part is chemical. You know, the year before I got into dental school, I did a 1-year non-thesis master's, and the paper that I wrote was basically about bacterial biofilms. I know, I'm really cool. I got all the girls as a result of talking bacterial biofilms. Just kidding, got nobody. But I am happily married with my wife of 15, 17 years now. I know that's also bad too, because I don't know the exact years at the flip of my tongue. My apologies. Anyways, in my non-thesis master's, I did some research there, and basically, if you do a mechanical removal of the biofilm, you can kill, you know, up to 70–80% of bacteria, something like that. If you just do the mechanical. If you just do the chemical without the mechanical removal, some of the research showed that you would remove about 50% of bacteria. The problem is that the outer layer of bacteria, if you don't penetrate it, you don't kill as much. And the biofilm adapts to that chemical attacker. But if you add in mechanical and chemical attacks of the biofilm, you can get up to 99, 97, 95% of the bacterial removal. And so that's what the target will be, okay? So the order that I would recommend you do your at-home cleaning would be flossing first, brushing next, and then having some sort of chemical attack, which would be your mouthwash. My personal preference is Listerine without the alcohol. Alcohol can be a carcinogen. Of course, there are no studies showing that Listerine causes cancer, or things in low concentrations of alcohol cause cancer, but we know that alcohol consumption over time can cause cancer. So just something that you want to add in to your at-home mix. So the order in which you're going to do things, and if you are a super high level person, you'll add in a water pick or a water flosser, because again, more mechanical removal of the biofilm will be helpful. You're going to floss first, and if you're going to do the water pick, you can add it in whenever, but you know what I enjoy doing is flossing first, brushing next, using the water pick, and then ending with the mouthwash. Okay? So by doing so, you're doing a mechanical removal and a chemical removal of the biofilm, and that tends to be and give the best results. You can even feel it on your teeth. Another high-level thing is using an electric toothbrush. Gives you the best results. I wish you best of luck on your tooth journey, and hopefully this was helpful for reducing the amount of decay or preventing the amount of bacterial biofilms that form inside your mouth.